So as I said, our topic will be colorectal cancer. If I should ask question, has anybody ever heard of this form of cancer? Just you can open your mic and answer.
No, sir.
You have never heard of it. All right, I can tell you of a minister of government who worked at the Ministry of Finance, and then he was at the Ministry of Social Security and so on. And I'm not taking any tail out of school, for it was reported in the paper. Honorable Donald Buchanan died from colorectal cancer. I was just looking on the information. He died in 2011 from colorectal cancer. And based on the story that I followed, his father died from it, and I think his grandfather died from it. So this form of cancer is one that can run in families. And let me see. But you know what the good thing about it? Because of technology, it is a cancer that can be prevented. In developed countries, you don't have the high incidence that we have out here and that some of the poorer countries have. Because I will tell you why in a little while, why that does not happen. All right, so we have some areas that we're going to look at. Overview of colorectal cancer. We want to look at the structure of the colon and rectum. We want to look at the functions of the colon and rectum. We want to look at how colorectal cancer starts and how it spreads. We want to look at some of the causative factors, the risk factors, and possible prevention. We want to look at early detection, diagnosis, and staging for colorectal cancer. And after treatment precaution of colorectal cancer. So just an overview, colon cancer is a type of cancer that begins in the large intestine or the colon. And the colon is the final part of the digestive tract. We will show a picture of the whole digestive tract in a short while. Colon cancer typically affects older adults. We say typically. So if you are in a family where it is rampant, more than likely it will start before you reach age 50. Though it can happen at any age. All right. This is a picture, not really a great picture of the alimentary tract. We will show better picture down the road. So we have the salivary gland that is important for helping us to soften the food that we eat. This is the mouth, a representation of the mouth, of course. And then the esophagus, which is the tube. That is the tube that through which the food passes to go to the stomach. The stomach is really a holding area. A little digestion takes place there, but it has to go along further for digestion. So if the food stays in your stomach, it will not be of any benefit to you because the stomach does not do a lot of digestion. And you have conditions that cause, you can have several conditions of the stomach, but as I say, we are not dealing with the stomach. You ever hear that people have ulcer stomach, which is actually a sore in the stomach, and when that happens, it is very painful. All right, you will see that the liver, but the liver is also an important organ as it relates to digestion. And the liver also stores a lot of things so that when you eat, none of it was stored, after a while, you would run out of fuel. For part of what we eat is to provide fuel, just like how you put in fuel in the car to get the car moving. It doesn't matter how the car is beautiful and how it is fast. Well, we know that you have battery and you have what they call, you have cars that run on batteries and partial gas, and you have electric cars. All of those modifications are there, but before those things, the car, you would have to put in gas. And most of the cars that are made nowadays are still have to put in petrol, whether it is diesel or gasoline, to get the car to move. And that is the same way if our bodies could not store anything, like in the liver, and when your body is ready for it, it is broken down to provide energy. We have a condition that we call diabetes. Sometimes, if you're a diabetic and another organ that is called the pancreas is not producing insulin, you will not be able to utilize some of the food that you eat, the sugar that you eat to produce energy. It can be floating in the blood and you are not able to utilize it. But this organ that produces insulin help your body to utilize. And they are all part of the digestive system. All of these organs, the liver, the gallbladder, helps your body to digest fat. And the fat is utilized as it is needed. I mean, not the fat, I mean the product of the gallbladder, which is called bile, is utilized to help you to digest fat. Most of the digestion takes place in the small intestine, right here. The large intestine circle around the small intestine. So it starts here, which is clear on another slide at a place called the cecum. And this part that goes up is called the ascending colon. The larger, the part that goes across is called the transverse colon. And the part that comes down here is called the descending colon. Well, the main function of the colon is to absorb liquid or fluid from the remainder of what is digested here to help it to form stool. Everybody know about diarrhea. And sometimes if you have a real bad diarrhea, you can't leave your house, you know. Can't leave your house or you go have accident on the road. So you have a part of the digestive tract called the anus. This part has some muscles that can help you to close off the digestive tract, that you can stay for hours without going to the toilet, even after you ate. But there's a danger to that. They have something that they call constipation, which is the opposite of diarrhea. And you know what? Some people say they constantly have constipation. One of the things is that they don't train the bowel to have regular, evacuation or emptying. So if you should empty your bowel a day ago, and you keep holding it, what is happening to you is that the water is being dried out, and the stool that is there becomes harder and harder and harder. And if you make it stay too long, you will have to strain to get it out, and some people have to take wash out and all type of thing to get it out. So one of the lessons that we'll have to learn is to train ourselves to have regular bowel action, drink a lot of fluid, eat a lot of roughage. You can't eat too much callaloo. You can't eat too much cabbage. You can't eat too much fruit and vegetable and nuts and so on. Those are things that give you the stool bulk. But if you just keep eating refined food and so on, it will cause problems to this, to the whole digestive tract, but especially to the colon. Everybody hear about the appendix, that sometimes children tend to have appendicitis. This is where it is found somewhere off here, just an appendage to the large intestine. And the rectum, which is this little area here, which is not very large, is where the stool is stored until you get an urge to evacuate your bowel or to empty your bowel. So an overview of colorectal cancer. Colorectal cancer usually begins as small, non-cancerous clumps of cells called polyps that form on the inside of the colon, or an area that we call the mucosa. That area produces a lot of fluid so that it helps to moisten what we eat when we go down there, along with the juice and the water that we drink. And it helps to moisten so that the let us call it food, can pass through. But after it leaves your stomach, it takes on new name. They don't call it food anymore. As it start to go in the intestine, they start to call it chyme. And the chyme is acted upon by certain digestive juices, which I will not go into right now, and to break them down into peptides and all so on. So the protein is broken down, the carbohydrates, but we tend to eat more carbohydrates than protein. Protein, the main purpose of protein is for rebuilding of tissues in our bodies. And you get your proteins from several sources, from peas. You can get some from peas. You get the proteins from fish, from chicken, pork, all of those meat. And all of them have to be broken down and digested through the small intestine. One writer in the Psalm said, "We are marvelously made." Let me tell you, when you think about those persons, when they do the genealogy in Genesis, that people lived for over 900 years. And these little organs that you call the intestine serve them all of that time, over 900 years. And I am certain that they were not having some of the problems that we have now, because they were eating, natural things. They were not eating refined things, which has caused a lot of problem, and the additives that you put in them, that we put in them. No doubt the writer said we were marvelously made by God. So that the intestine, I'm talking about the intestine now, could function for 900 years without any problem, without bursting, without all of those things. God is good to us. So we say over time, some of these polyps, and we're gonna show you in a picture what the polyps look like. Some of them change and can become cancerous. It might take up to 5 or more years for that to happen. So if you were living in a developed country where they do regular screening for colon cancer, they would put a tube up through the rectum and they could view all of the colon and identify the area where you have polyp. And they could remove the polyp. And when they are removed, the chance of cancer is cancelled for that person. I can mention other name because that name was in the news. We have former opposition leader, Dr. Peter Philip, based on the news, newspaper and radio news, that he was diagnosed with colon cancer. And when we get down further, you will see that it is no respect of person. As a matter of fact, I can tell you right now that it is in the United States, it is, I think, the third or the fourth most frequently occurring cancer. And in Jamaica, it is similar. I went to a conference from 2011, and somebody who was presenting mentioned that it was either the third or the fourth most frequent cancer in Jamaica. And the distribution in men and women is almost similar. Polyps may be small or produce, or there may be few. If any, and they might have symptoms or don't have any. And for this reason, doctors recommend regular screening tests to help prevent colon cancer by identifying and removing polyps before they turn into cancer. So I am saying that although they are dangerous when they become, they reach like the late stages, if you find it early, you can avoid getting cancer of the colon. All right, this is another picture of the colon. So the rectum as usual, the appendix, the cecum where it starts, and we mentioned about the ascending colon, the small intestine, which we are not really dealing with now, but we talk about the function. We talk about the gallbladder, which stores bile, bile is actually produced in the liver. So that liver that you see there, if you take out a man's liver, cannot survive, cannot live. And we talk about pancreas that produces insulin. It produces other things too. But there was a famous man associated with the company that make iPhone. Anybody remember the name of the company that make iPhone? You can talk to me, open your mic and talk. I don't like to feel that I'm alone.
Apple, Elder Fagon.
Apple. And we know that Apple is a very big company. But it was overtaken by Microsoft recently, though. Microsoft made a big surge on the stock market. Well, the reason why I mentioned that gentleman, he had not colon cancer now, but he had cancer of the pancreas. Steve Jobs, I'm talking about. And You know that if it was for money's sake, Steve Jobs could be alive today. They did all liver transplant and everything and treated the cancer in the best way that they thought possible, only for it to return and to take down Steve Jobs, leaving the company that he has formed. And he was just in his early 50s when he died. So this is one cancer, the cancer of the pancreas, a deadly cancer. Deadly, deadly. It is never usually found out until it is late for you don't have any symptoms. I say I'm not dealing with much of these, but I have to mention that. I know of famous Jamaican lawyer, Ian Ramsey, was taken down by colon cancer also, several others. All right. This is a clearer picture than the one that I showed you, but it's actually showing similar organs and structures that we dealt with before. To understand colorectal cancer, it helps to know about the normal structure and function of the colon and rectum. The colon and rectum make up the large intestine or large bowel, which is part of the digestive system, also called the gastrointestinal system. So let us not be confused and fooled by this term. They call it the alimentary system, the digestive system, the gastrointestinal system. It could be like when you hear about 6, half dozen, all of them are the same thing. Most of the large intestine is made up of the colon, which is actually a muscular too, because both the small intestine and the large intestine have to have some nervous sensation in it. As a matter of fact, they call the gut or the whole structure of the digestive system that it has its own brain. But you notice that you don't have to give it instruction to function. Once you eat, you don't have any more control over the food. God made us that even if you turn upside down, you will not vomit, because I could go back to that digestive system, back to the esophagus. There is a muscle, or what they call a sphincter, at the top of the stomach, that after you finish eat, it closes off. And only when people have abnormality, then the food will go back up. But even if you turn your head down, digestion will take place. And the food will churn, the stomach will churn the food over and over, over and over. So when I hear people telling me that you need to drink this first, like water and whatever first, I just say, you don't know what you're talking about, because whatever you eat, it's gonna stay in the stomach until it is churned and properly mixed before digestion start in the real way. And small amount goes to the intestine, the small intestine, by a process that they call peristalsis, in which the one part of the intestine closes off and pushes the food along. And as the food is pushed along, digestion takes place until all of the food goes into the large intestine. And as I say, we are wonderfully and marvelously made. And we can give God thanks for just one stroke of creation. And let me say, a lot of scientists come on the scene and they study this and they study that, but there are parts of the body that we can't explain fully how they function. You give your thoughts, but let me see. not everything that man know about fully. And then when you go to the large intestine, it has another process. So the peristalsis is a wave that come every now and then and go towards the intestine to push the food along to enable digestion. And when it goes to the large intestine, you have a process that I call pustra, which a segment of the large intestine, based on the nerves that are there, closes off and just shuttle the remainder, a portion of what you eat, that we say, we don't call food anymore once it leaves the stomach, along. And as it pushes it along, water is digested or taken out. And then let me say, everything that you eat, we have a major vein that they call portal vein that takes all of those food to the liver for the nutrients to be taken out and distributed and stored, some of it stored. And then it goes into the general circulation for it to be absorbed by the tissues of the body. We're marvelously made. So you have the general circulation and you have the portal circulation, which I will not really go into right now. But just we have to, why we'll start, we pass by, we have to give a little explanation. So to understand the colorectal cancer, we say you have to know a little about the bowel. And the whole of the bowel measure, the large bowel measure about 5 feet or about 1.5 meters. The small intestine is much longer than that. But as I say, we're not going in the small intestine. The parts of the colon are named by which way the food is traveling through them. So you have ascending, as I said, transverse, descending, sigmoid, anus, and all of those areas, they have different areas and based on the function that they perform. So the first section, as I mentioned, is called the ascending colon, the part that I show you over this side that goes up. It starts with a pouch called the cecum, where undigested food that comes, what do we say, partially undigested, from the nutrients would have been taken out. But we're talking about the liquid. It's still in it, and it needs to be more solid to be stored in the rectum. So it continues upward and goes across in the transverse colon, and then it comes to the descending colon. So the section is called a transverse, the one that goes across the colon. It goes across the body from the right to the left side. So sometimes you hear idle boys talking like downtown. I will send you up a public. I will send you a public. When you get a stab, when they get a stab wound in the abdomen, with all of those structures that are there, can you imagine how much work it takes to mend all of those structures that might be affected? The liver might get damaged, the intestine get damaged. And when the intestine get damaged, one of the problems is that all of the contents will be thrown out in a cavity that is called the peritoneal cavity and will infect that area. So what they will have to do when they're doing the surgery is to wash out that area with normal saline and have to put them on antibiotics So one idle boy can cause regular surgery that is planned for your grandma, for your grandpa to be postponed because when they come in, they call them emergency. And if you ever go to KP, to the emergency area, and see the type of trauma, I'm not talking about much about trauma that can not be prevented, We're talking about the number of people who get caught. I remember when I used to do sessions there was a doctor that was assigned to do suturing of various sort. Can you imagine uncle that they have to do? And sometimes they can't clear up the number of people that they have to sew up, call it that. I have diverted from the topic, but it is important. I'm saying that if you have an idle boy, listen, I will send you a public, Sometimes it's an abdominal wound or it's a chest wound or whatever. With them knife or the ice pick. It put a lot of pressure on the hospital, unnecessary pressure. And the people who are waiting for care can't really get it because those are the emergency. All right, I move on. The fourth section is called the sigmoid colon, that is on the right. Because of its shape, it has an S shape. And it calls the sigma, and it joins the rectum, which then connects to the anus. So we say the rectum is where food is stored. And you have a strong muscle there that prevents you from just, from it just running out, like what happened to babies before it becomes, well formed and before. And sometimes babies find pleasure in just letting out anywhere, just letting out and mess up. And that is why you have to put on pampers. But when you become adult or become a child going to school, I remember that you have to do potty training, and it should be done early before they go to kindergarten to give teacher trouble, to have to be turning toilet teacher. When the children are trained, then they don't give so much trouble to go to school early. By 3 years, the age of 3, they should be able to control them bowel and not just pass stool all over the house. But it takes training. The ascending and transverse section together are called the proximal colon. The descending and sigmoid colons are called the distal colon. All right, so as we said, the function that it absorbs water and salt from the remaining food matter after it goes to the small intestine and small bowel. The waste matter that is left after going through the colon goes into the rectum, the final 6 inches or 15 centimeters of the digestive tract. Only thing that section tends to be bigger than the colon itself. It's bigger to hold, and some people it can stretch too. But let me say, as I said, you should not be holding your stool too long. As soon as you feel the need to void, go and void. Because if you keep it too long, if you keep it like a whole day longer than you should, it is going to get too hard, and then you have constipation. And some people, elderly people who have constipation, is not real constipation. It's because they're not evacuating the bowel often enough. So, and when you have a situation in which everything slows down, but when you're on the move, walking and so on, that helps to propel what is in the bowel downward. But if you are just sitting at a desk, or if your system slow down, and then you can get constipation from that too. So the the remainder of the food that you eat, it's stored there and it is until it passes through the anus. And nobody knows to talk adult about that. For all of us is what we have to do. And that is what we have, why we have to have toilet, whether it is attached to your house or wherever. And we know of situation in which people are poor and don't have any toilet. Let me say, you know that in some communities, and I want you to talk to me. In some communities, you don't have a house, every house don't have a toilet, you know. Anybody know about that? Why it look like I'm me alone? Everybody here in there?
Sir.
Yes,
Yes,
sir.
sir. True,
Yes,
sir. So
sir.
true,
You
sir.
know, talk to me. You know of any situation in which a house don't have any toilet?
Yes, sir.
Yes, sir. Yes, sir.
Yeah, so what happened during that time then?
But then God
Ask
Sir,
flush it.
again.
Scandal bag and throw it out.
some of them
Use
use
the term,
scandal
man.
bags.
Parachute we talk about. The parachute.
Yes, sir. Scandal
And
bag.
some
No,
dig
it is
hole, sir.
some people dig hole, which would be a better thing to do. And others putting in the scandal, and then scandal can't get so much again. So what you gonna put in there's something about the clear plastic,
We put in a juice box.
but everybody should have their own toilet, man. Come on now. No house should be made without a toilet, if I even outside one. And the outside one is not safe at night time. I know somebody who got a toilet for themselves after many years of using a communal toilet. And I'm telling you, the person was so thankful and get their own bathroom where they can bathe. Me I tell you, a big something that in some place, you know, when you have your own bathroom, don't take things for granted. We take things for granted because we have our own bathroom, and sometimes we have more than one in the house. But you have some families that one we are serve, there are 15 people, and then you have a community one we talk about. You think we're poor? Some people are worse off than we. And can you imagine when you want, that is why they have to do the parachute, you know. But if when you want to do it, it is occupied. What you going to do? You can't hold it. It can come down for you. Have you ever been in any situation where you want to use a toilet so much, whether it is to do number one or number two, that you're uncomfortable? I've been in that situation more than one time. And that is why when you go in on some certain trip, far distance, you have to know how you're going to manage that. They have to give regular stops so that people can get to evacuate. I remember one time we were going to country, to Montego Bay, to a wedding. Sister Fagon and I, you know, a neighbor invited us to their wedding. And we had to carry something in the car to facilitate them to pass urine and store it, because they can't keep the urine for that long period like we can. So you have to carry the good old chimney. You know it? Anybody know the chimney?
Yes, sir.
Yes, sir.
Yes,
Yeah,
sir.
man, the good old chimney. You carry the chimney and you used to
I
have
have it
the,
now.
yeah, you used to have the enamel one, and now they have the plastic one. And it is a very good help, you know, for people who can't hold the urine. Sometimes they have to keep it at them bedside still. And then you have the commode too. Commode, it's kind of, you have a little, something like a little chair that you sit on, a little seat that you sit on. And then you have the pail underneath it. And it can make you feel comfortable in the room. But if if other people in the room, it's not so comfortable for them though. I can tell you that. And sometimes people use that for especially elderly people who can't are not so mobile to find them way to the toilet. But they need to cover it as soon as they finish, that other members of the family can help to carry it to the toilet. But how me reach us up? And I know this is me type about. No, no large intestine me type about. There's a connection. So me not going too far off track. All right, this is another picture. All right. How does colorectal cancer start? We say it starts as a polyp. And let me say, the larger the size is the larger the problem. When it starts to grow, if you have polyps that are larger than 1 centimeter, and what is 1 centimeter? It takes about 2.5 centimeters to make 1 inch. So you know that we're talking about less than ½ inch. It is time for it to be, and if you have more than 3 polyps in that colon, it is very important. So colorectal cancers form from polyp, and it can grow into the wall of the colon or the rectum. And over time, the wall of the colon and the rectum, which is made up of many layers, if the cancer continue to grow, it can grow through the wall of the colon. So it starts as a mucosa, and then you have the muscular layer. You have several muscle layers, and the outer layer, serous layer, it go and grow through all of them, and then start to attach to other organs. Them time there, it get bad. But we're gonna show a picture of it's a picture of the normal colon, a cross-sectional picture. So you see the muscle layers and all of these layers, which are made of cuboidal and so on, type of cells that help it to absorb. And this is another section of the colon, the cross section, and see the different type of layers that are here. But we're gonna show another one now where the staging of cancer. All right, this is stage 0. But you see a little structure here. This is a polyp that is growing. This doesn't have any cancer in it as yet, but it has the potential to become cancerous. So it is at this stage that we would prefer if it is caught from the precancerous stage. But it can only be caught if you do screening. This is stage 1. The polyp is growing bigger. You see this area here? Anybody see where I'm pointing on there? You know, see a little white area?
Yes, sir.
Yes, I'm seeing it.
Well, that is cancer. That is cancer that is spreading there. So this is stage 1. This is stage 2. This is stage 3, how it is going. And look on stage 4. What has happened to it? It gone through the wall of the intestine. When we call it intestine, we don't wrong, it's a large colon we're talking about. Or they call it large intestine or the colon. So when you get the, I believe a certain politician, when they found his own, it was like maybe about stage 3 or 4. So you know that for them to do surgery, sometimes what they have to do a resection, cut off part of the intestine that is cancerous. And when you do that, what you do, the amount that is left to absorb fluid is less. So sometimes they have to put them on restricted fluid intake for a time until the rest of the colon get adjusted to it. All right, I think I need to go back some more. All right, go back to this slide. I've been reminded that I need to manage my time. How much more time I have?
It's now 24 minutes to 9.
Yeah.
We normally go up to about 9 o'clock, so you can go until I guess you're finished. Hopefully about 9:30 the late, 9:15 the latest.
All right. So I will try and control my time so that I don't go beyond 9:15. For I have my timer here. All right. So when cancer cells that are in the wall, they can, if the cancer goes through, it can get into the blood vessel or the lymphatic system. The lymphatic system is a kind of parallel system to the blood vessels that help to mop up or to absorb the fluid from the interstitial space, that is the space between the cells and so on, and bring it back into the bloodstream. So when the cancer spread in the blood and the lymph vessel, take it to the part of the lymph vessels that help to fight infection. And there is where it's stored, and then they start to grow and get bigger there. So instead of just having one area where you have cancer start to spread all over. That is how cancer spread. So it can spread by the blood vessel, by the lymphatic area, of local spread. From there, they can travel to nearby lymph nodes or to distant parts of the body. So when you hear them say them treating cancer with chemotherapy, that we're talking about medicine that they use to destroy cancer cells. If they have a local area, they can use radiotherapy alone sometimes, but they can have targeted radiotherapy treatment within tend to kill. But when it starts to spread, it becomes a big problem. So the main way to manage cancer very effectively is to catch it early. And let me say, they have something that they call cancer survivors, where people can say, if you live for 5 years, that is the minimum they usually use. Say if you live for 5 years, that you have recovered. We're talking about cancer-free. If 5 years you are cancer-free, then they say you get a cure. Eh? And some people, like in developed countries, if they catch it at stage 1, we show you the different stages. If they catch it at stage 1, after 5 years, more than 95% of the people would still be alive. And if they die, it would not be from the cancer. That is how good the treatment can be, because you catch it early. When it goes to stage 4 and so on, then you have less persons who will live for 5 years, because it starts to spread at different places and you have to go give more aggressive treatment. All right, we have gone through this already, but just to go over the stages, it is stage 0, where although you see a polyp start, it is not cancerous. But over time, it can become precancerous and then cancerous, where it starts here and it increases here until take over the whole, it goes through the colon, and then the colon cannot get to do its function. it causes blockage, and then people will have to be straining at this tool to get it past. But I say, I just this little space down here, so now, you know, just this little space in here, so all I hear, so block off with the cancer. And it's not only coming this way, it's going that way to attack organ, other organs that are attached to it. So the stage and the extent of the colorectal cancer spread depends on how deeply it grows into the wall, and if it has spread outside the colon, if it has enough time undetected, then it will spread. Nothing will prevent it. You know that if children have worm, and if they are not getting treatment, the worm will stay and multiply. I have known of situation that worm in the digestive tract, children have worm so much that it causes death. And that is the same thing with cancer. And at the same time, you know, worm can be treated so easily. You can get over-the-counter preparation to treat something that they call Zentel. Zentel, as some way treat worm, you know, treat them so good that, you know, if you make you pass them out, they cut them up. But sometimes people used to be afraid to see the long worm and pass out. And those are not the most dangerous worm, you know. Some more dangerous worm hang in the small intestine and a feed and the nutrients that the child should be getting. If you don't get them out there, the child might become malnourished and so on. Not talking about cancer, but we have to mention some of them things too. All right, what are some of the signs and symptoms of colon cancer? You could have a persistent change in one bowel habit, including diarrhea or constipation, or a change in the consistency of the stool. If you saw this blood in your stool, and sometimes when it occurs high up, the blood is digested and you don't see it. It is what we call occult blood. But lower down the tract, you will see the blood. So sometimes people can be bleeding and you don't know because it's high up in the tract and it is digested. And if it is not a lot of blood, it can go on for years or for a long time until the person becomes malnourished and so on. Then you have rectal bleeding or blood in the stool. You have persistent abdominal discomfort, such as cramp or gas pain. And I don't want anybody to start diagnosing themselves yet, because I know somebody who was suffering from a condition that we call hypochondriasis. Anything you talk about, that person feel that they have it. And the person will reach a stage that they had to have what they call exploratory surgery, abdominal surgery. And when they open, not a thing. I just mind. Not a thing wrong with the person. Just believe that they had it. But anyhow, afterward, they would have had peace of mind. All right, a feeling that one bowl does not empty completely. You must be able to have the ability to empty your bowl fully. And then it could lead to weakness if you are losing blood and so on. Unexplained weight loss. So it's not only diabetes and those things that can cause weight loss, but some other things. All right, we're looking at some statistics from the USA. All right, excluding skin cancers, colorectal cancer is the third most common cancer diagnosed in both men and women in the United States. And as I said, I can't tell you about the Jamaican situation because it's a long time that I've not gone to a conference. But when the last conference of such nature that I went to in 2011, it was the similar, either the third or the fourth most frequent cancer in Jamaica. So sometimes we have men conference and we just focus on prostate cancer. Yes, that is occurring very often, but cancer of the colon is also a frequent one. And I know of brethren who have this form of cancer. Don't want to call any name, but if you do your search, you will find out. The American Cancer Society estimates that for the number of colorectal cancer cases in the United States for 2021, that it will go up to 104,270 new cases we're talking each year for this year, 2020. And they separate them from rectal. We just put the two of them together and call them colorectal. And 40,000. Big population, but still. And it is coming down. They used to have more than that, like in the 80s. But because of screening that is taking place and lifestyle changes, that is what has been bringing the incidence down. Overall, the lifetime risk of developing colorectal cancer is about 1 in 23. So 1 in 23 person will develop colorectal cancer. So every 100 person, 4 have the possibility of developing colorectal cancer. You see what we're talking about? It is a big problem as it relates to cost of treatment that they call the burden of disease, of the disease. When you talk about the cost and the man-hour that is lost by people who could be active at work, who have to be treated, they call it burden of the disease. And we are talking about for men, 1 in 23, for women, not much, 1 in 25. The rate of people being diagnosed with colon or rectal cancer each year has dropped overall since the mid-1980s, mainly because more people are getting screened. So when they screen, they find the polyp and they remove the polyp, and then they're fine to go. They don't need screening for another 5 years or so. And people are getting screened and changing their lives related risk factors. There's no way, all right, prevention of colorectal cancer. There's no way to completely prevent colorectal cancer. However, there are things that one can do that might help lower one risk. They have what they call genetic testing. So if you are in a family where cancer is prone, genetic testing is done. I did not go into those details because I know that it is a church group that I'm presenting to. And if I had gone into those details, it would take a long time. And the screening that we're talking about with colonoscopy, I should have really get a picture of a colonoscope and show it what it looked like. That it had a tube, electromagnetic section that when you put it in the rectum, it magnifies what you are seeing. And it also can be used to help to dissect. So you have what they call screening colonoscopy, and you have diagnostic colonoscopy, in which the main purpose of doing it is to get a little bit of tissue for them to send to the lab to test, what they call histology test, to determine whether or not it is cancer. For you guess cancer, you have to be definite about it so that the treatment can be done properly and in a targeted manner, and that the person can recover. Finding cancer early when it is small and hasn't spread often allows for more treatment options. Some early cancers may have signs and symptoms that can be noticed, but that is not always the case. All right, a diagnostic colonoscopy is just like a screening one, but it is done because a person is having symptoms or because something abnormal was found on another type of screening test. Like they could do a blood test and it found that you have abnormal cancer cell, and they decide to go in and find the primary, what they call the primary lesion of the cancer, and do a biopsy so that it can be sent for testing. For this test, the clinician look at the entire length of the colon and rectum with the colonoscope, a thin, flexible, lighted tube with a small video camera on the end. It is inserted through the anus and into the rectum and the colon. Special instrument can be passed through the colonoscope to do the biopsy or remove any suspicious looking areas such as polyp if needed. That is how they do the biopsy. And for men, it is said that men are afraid for people to put up things in their rectum, because in Jamaica, which they say is a homophobic country, we're afraid for, especially if it is being done by another man. But let me say, women also do it, so it doesn't have to be a man. And if you're afraid of being examined, your prostate by cancer, you prefer to have the cancer there and kill you eventually. I have gone to Cancer Society and I am going to make an appointment shortly to do another one. But let me say, I'm not think I'm ready for dead yet, you see? I'm not really ready yet. So I am going to live as long as I can. And I'm going to. And the Bible said that you wish that you will prosper and have good health too. So Christian must have good health. And let me say, some of the risk factors for this same type of cancer, I did not mention, like smoking. We don't smoke. Christian don't smoke. Drinking, heavy drinking is another risk factor. We don't do that. So we eliminate two of the risk factors. And even if you used to drink and you stop now, it is a big burden. If you used to smoke and you stop, you still have some residual thing that can happen to you. But if you stop 10 years ago, you're better than a person who is still smoking. And if you stop 15 years ago, if you never start, you're still better off. So those are some of the things that can increase the risk. If you just at a desk every day, and you know, get up and go do some exercise, it is a risk factor too. And it is a risk factor for other things, like obesity. So we need, another thing is, you know, just eating, and don't moderate what you eat. Refined food that we buy, I mean, I call the name of any or sins, but we know them. They are risk factors. We need to eat a lot more bulk. As I say, you can't eat too much vegetable. Vegetable has a lot of bulk to help you to form the stool and help you to pass through and to help to. They talk about colonic lavage. Let me say, people in the medical field don't recommend that. You hear? The only time that they do that type of cleaning is when they're gonna do tests. The bowel has its own method of cleaning itself. And you don't need to have anybody say they're gonna give you colonic lavage to clean. Sometimes what they are washing out is important thing for your digestion of your food. And in the old days, parents used to give wash out every time you go back to school. Let me say, it was not a good thing. And the yellow thing where you come out, all the bile and thing that is important for your body, they say, Jesus, look on where I come out of the picnic. Yeah? Look on it, the yellow something. Let me say, that is how it is made to look. Why it is bile, it is bile upon it. And let me say, if you have a situation where bile is not acting on the content of the colon, you would like to see. I have seen people where the bile duct is blocked off and the bile is not running into duodenum to connect with the food that is coming down there. It's white, so bile has a purpose to help to color the stool too. And the bile, as I say, is useful to help with the digestion of fat. It breaks up the fat into little pieces where it can be digested into something that called chylomicron, if I remember in my anatomy and physiology. And it is absorbed and go to the liver and stored there. And let me say, if you eat anything that you eat too much, is stored as fat. Even protein, if you eat too much of it, that cannot be absorbed. It is stored, converted by the liver and stored as fat. But you don't need to eat half a whole chicken. No, once man, you don't need to eat half a whole chicken one time. You don't need it. And let me say, whatever you put in, will have to put out. If not, it will stay in your body and help your belly to get big, like for me. And then you have to go do the exercise to get it done. Eh? Sometimes we overeat and sometimes we are not active enough. And you hear me talk about me. It's myself me talking about. And our bishop has lost quite appreciably amount of weight. When I'm finished, he could tell how you achieve it. Because it's not easy to lose weight. I can tell you. Any lifestyle change you need to make. It's not easy. We can give the instruction and say, you need to do that and you need to do that, but do it on yourself. And say how hard it is. So colonoscopy can be done in a hospital, outpatient department, in a clinic or in a doctor's office. Some of them have the facilities and they do it. But let me say, the cost is the big thing. It is not available so much in the public sector, where they do a few, but like what happened like all in England, in America, where you have public hospitals that don't charge anything. The state pay for the services. And if you are, or they have what they call Medicaid, and all of those things help to pay, but you don't pay any money out of your pocket. And when you reach a certain age, you're golden, you know, you get special treatment. They are developed countries, we don't have the resources to do that. We hope that we can reach there someday. They have what they call now free healthcare. Talk to me. When they were going to make it, and let me say, I am not criticizing any particular administration. I am a health worker that I work for anybody, but me talk my mind too. So when they were establishing the free healthcare, nobody never asked what quality. For free healthcare is not just to go have the chance to go in a hospital. And the people know ask about the length of time to get service. Any healthcare in the world, when you go into developed country, like how you see them pack up at the emergency where everybody go one time at KPH. And also you go other places, then get the appointment and then go in orderly. And now if you have wait so long, but they have more caregivers. So there's a test that they call proctoscopy too, which is similar, almost similar to the colonoscopy, only that it is a different part of the what you use to examine the rectum, the early part of the from the anus go. All right, other things that you would need to do is lab tests of biopsy samples, imaging tests to look for the colorectal cancer. And one such is computed tomography, or CT, or CAT scan, and several others, and ultrasound that they would use. All right, let us look at treatment. And after that, I will be coming along shortly. I have one more topic subheading after that. If one has been diagnosed with colorectal cancer, one must discuss one's treatment option with the cancer care team. In Jamaica, it might be a one doctor, but in more established centers, different whole team of people you're gonna interview you, and they have a discussion like a round table discussion, and tell the possibilities, tell the stage of the cancer, and the oncologist is the one who is a specialist in the treatment and the prescribing the amount of treatment that you get for the cancer would play a major role there. But in any case, you need to have a part in it. I know of a nurse, one of my colleagues, who was sick. He used to work in the operating theater. And they wanted to have an exploratory operation. And he said, nobody touched me. I am not going to go under that surgery. And the man stayed there and died his peaceful death. He said, nobody touched me. But I know what can happen in an operating theater. If you come cut my body, and then after that, I might die. And I am not here to frighten anybody. Some people have had 20, 30, 40 surgeries and nothing happened to them. But he decided that you're not going to cut me, you're not going to touch this body. You're going to do no exploration. And he preferred to die in the condition that he was. I went to his funeral. So it is important that one thinks carefully about each of the choices, weigh the benefits of each treatment option against the possible risks and side effects. So for treatment, you have local treatment that treat the tumor without affecting the rest of the body. These treatments are more likely to be useful for earlier stage cancers or the smaller cancers that haven't spread, but they might also be used in some other situations. Systemic treatment, colorectal cancer can also be treated using drugs, which can be given by mouth or directly into the bloodstream. These are called systemic treatment because they can reach cancer cells throughout almost all the body. Depending on the type of colorectal cancer, different type of drugs might be used. Not going further than that with treatment, or those are specific things that the doctor discusses. Living as a cancer survivor. For many people, cancer treatment often leads to questions about the next step as a survivor. I'm a survivor. If you live until you, for 5 years after, we say that is considered a cure. And when you start to reach 10, you hear them talk about breast cancer survivor. People go all them 25, 30 years, and the cancer not returned yet. But it depends on how early it was treated and the type of cancer. So for cancer, it's not one entity. It depends on the type of cells that are affected by the cancer. Some are more aggressive, and some, the treatment is more successful. Treatment may remove or destroy the cancer, but it is very common to worry about the risk of developing another cancer. And some people do. And some people have done their risk analysis for even breast cancer. And if they have one cancer in the other, or in one breast, they could have the other one for themselves. Me, it's not gonna take me down. I can live without my breast. Although it is not so easy for a woman to live without her breast, for the breast give her shape. And the flat chest thing don't really look so good. I can tell you. And then the implant, plenty people want the implant because of the thing associated with it. For a breast, the breast is important to a woman. Don't let nobody tell you anything otherwise. All right. Treatment may remove or destroy the cancer, but it's very common to worry about the risk. Oh, I've gone there already. Let me continue. If one has completed treatment, one will likely have follow-up visits with one's doctor for many years. It is very important to go to all of the follow-up appointments. During this visit, the doctor will ask if one is having any problem. That should be is there. And may do exam and lab tests or imaging tests to look for signs of cancer returning and new cancer treatment side effects. And that is the end of my story. Thank you for your attention. And I think based on my time, I have time for a few questions. It is now 6 minutes after 9. Thank you for listening. And open your mic and talk to me now, ask the question, and if I can answer, I will answer.
Thanks, Elder Fagon, for a very insightful presentation. Are there any comments or questions for Elder Fagon at this time?
I have one. Elder Fagan.
Yes, sir.
The one of the treatment that sometimes people say they use for cancer is chemotherapy.
Yes, sir.
Chemotherapy. But they also I'm learning that they can use what we call now laser treatment.
Yes, they can use laser.
Yes.
And laser is so good for laser. You can use it to do surgery. And it is so direct that you just get the laser beam to the exact area where you want it to. But it can't do surgery for everything.
Okay,
So,
thank you. Thank
yes,
you.
sir, it can't do surgery for everything. So like for eye surgery and so on, laser is used, and for some other surgery, but not everything.
Thank
But you also have what they call minimally invasive surgery. So for minimally invasive surgery, you have to talk about robotic surgery.
I don't reach us yet.
Oh, well, I remember our former presiding bishop who died there, Boaz, said he was being operated by them using, I mentioned the name a while ago. They did surgery, robotic surgery. You have a robot that the doctor uses, manipulate to do some I saw it in action the last time I went abroad to a private hospital. I saw robotic surgery being used to do an operation on the not the liver, the lungs, to take out some cancerous cells. And after that, they will treat them with potent chemotherapy. And then they will do tests again to see if the cancer cells are finished killed. But one other thing with chemotherapy is that sometimes it not only kill the bad guys or the cancer cells, sometimes it kill good cells too. And that is one of the drawbacks. And sometimes it causes people to lose their hair. But we have seen people who have recovered from chemotherapy. There is a sister in All Saints. We know her, Sister Evangelist Fiola Evans. She was diagnosed with, I think it was breast cancer many years ago. And they had to do chemotherapy that caused her to lose her hair. But when you look at her now, you couldn't see that she has not. And I know that she is doing her monitoring. And since that time, she went and studied and did law and is now a practicing attorney. So it is not done all over once you get cancer to say life done. Cancer can be defeated. A lot of people fight cancer. And one of the ways to fight cancer too is with nutrition. But you have so many different forms of cancer. You heard about Colin Powell, former military officer and Secretary of State of the US, who died recently. He died from COVID, but one of the reasons why he died from COVID is that his body, his immune system became so weak, but he was fully vaccinated. But he had a cancer that they call a cancer of the blood forming tissue. It is not leukemia. It's another type of cancer. I'm just not remembering the name right now, but Colin Powell died from that cancer. And you have so many people who are dying from different forms of cancer in Jamaica. When it comes to cervical cancer, that is another form of cancer that can be treated successfully, you know. But sometimes our people, you know, that we are a set of people that we are not a health-seeking people, you know. We go for sick care. So like some other people, when they're healthy, they go and check out themselves. And I know what I'm saying. I work in the public health system as a nurse practitioner for about 10 years before I did education. And if you find a child with a leaking ear, a ear discharge, and you treat them and say, come back whether or not the child recover, 5 days time, I want to see you again with the child. Sometimes if the child get better, you know, see them, you know. But let me say, if you had done the second visit, maybe it could prevent other incidents in the future because they could give you education and tell you what to do. But we seek for sick care, so we tend to see them and watch it. So we have the constipation, and a long time we're not able to go out. And we take me local treatment and we watch it and we watch it and we watch it. Only when it gets so bad, we can't manage it now. And you say, I tell every doctor, for me, now I give doctor my money, so. That's what we say. And we seek care, we go after. But preventive care is cheaper and the result is much better. I see something in the chat. Let me look at it, see if anything addressing me. Oh, that was a microphone that was calling. My friend just died from colon cancer. The person who put that in the chat, you want to put some more meat on that? Are you afraid? You know, don't mention the friend name, you know. It's a discussion we're having.
Tai, I see where Ella Fagon just mentioned that you mentioned something in the chat about your friend dying from colon cancer. He's asking if you want to expand on it. If not, that's okay, but he's just asking if you want to expand on that statement that you made.
Yeah, because we wouldn't hear like the age of the person and so on. That is important to us. But I did say that usually start, you know, in the 50s, over 50s. But if you are from a family where it is frequent occurrence, or there is a tendency for people to have cancers in that family. For I mentioned a minister of government, Danny Buck. I just checked Danny Buck history. Danny Buck born 1942. So that would have made him what, about 68 or 69 when he died in 2011. I mentioned Dr. Peter Phillips because that was in the news. We not take no story, no something out of school. And people were even talking about his health, if he could be opposition leader and go through all of the rigors of campaign and this and that. But Dr. Phillips is still alive and maybe enjoy better health now. So as I say, none of these diagnoses is death sentence. And fighting cancer is just like fighting COVID, you know. I remember having read Elder from St. Anne there, his story in one of the something about how he was diagnosed with cancer and his wife, I think, got it to his mother-in-law, and them stay home and fight it. So giving up is not an option when it comes to cancer. That's something you can fight. Eat good food and fight it. Take your treatment and fight it. Because if you want to see your grandchildren and your great-grand, fight it. Why does all give up and die? and you can fight it. I remember I used to, when I used to get a, somebody is talking now?
Yes, Elder. I was asking, sir, if you would have to do it separate from like you're doing a prostate test. Is it separate? You would have to check for colon separate, or is just one thing?
No, it is separate. As a matter of fact,
Oh,
you can check your prostate without doing an invasive test, like of the rectum and so. But they usually do prefer to do that for sometimes the prostate can be enlarged and can be cancerous. And when you do the PSA, it doesn't pick it up. I've heard of so what they usually do, they feel for the contour, what we call the contour of the prostate. And they can tell you it is not supposed to be rugged. It's supposed to be smooth.
okay.
So the people with the experience can know that something is abnormal. They might not be able
Yes,
to tell you that it is cancer, but they can do a biopsy. And that time they can determine what it is. But let me say,
okay.
what I would like persons to do is to identify topics that they would, I don't want, and I will not be the only presenter either. We can invite presenter, and this is up to our pastor, how often he allows it. But I don't like to be one presenter. Get outside people and you say like, oh, it is Zoom. No, hard to get people. And there are topics that I can address. Though I can read, but I mean, sometimes I don't want to be the only person talking. Because where you have just one person talking, it will become boring after a while. But yes, I see the person responding that the person was 54. I wonder if they were taking any precaution. I'm not blaming any victim, trust me. But when you have symptoms, you should get them checked out. But a very famous Jamaican died from colorectal cancer. Anybody heard about Karen Smith, that what they usually call her, the songbird? And I'm not taking Taylor out of school because that was all in the news. Karen Smith died from colorectal cancer. She was just 60. I remember if it was lack of care, he could pay for all the care and other family members would help. But she died. So as I said, the lifestyle incident in America and in Jamaica, it was similar. That out of 100 people, when it comes to men, 4, that is 1 out of every 23. So 423 is 80, which is 1292. Not even 100. 4 people will get it. Then you say, widespread something that in the country. It's not a one-man thing, it's a big thing. And 3.5, so nearly 4 women would get it too. So it almost spread equally. Well, in 100, in 92, 4 men, in 100, 4 women, almost equal. And when I start talking about some other form of cancers like breast cancer and cervical cancer and prostate cancer. So this matter of cancer has become a big lifestyle problem nowadays. All right. Any other question or any other comment? Let me read some more chat. Nothing you're foolish, I prefer if you talk to me than when me have your search chat.
Yes, sir. Just want to say something here, brother Brown here.
Hi, Brother Brown.
Yes, sir. What they do know, I hear you talking about what's the name again now? Da, 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 da. I forget it. The prostate test.
Yeah.
I went to do mine recently. I just went to do a checkup and I did one. And what the doctor do is she draw blood. They didn't insert anything in the rectum. So they're doing it by blood test now.
No, it's not just no. The test is called PSA, which stands for prostate specific antigen. But let me say, that is not a specific test. It cannot diagnose cancer. It can tell you that something has gone wrong in the prostate. And when the prostate is cancerous, it always increases the PSA. So the range of PSA is like 0.5 to 2 normal range, nanograms per milliliter. That is a measurement that is not so familiar to persons. But if you have inflamed prostate, that will be increased. If you have an infection in the prostate, it will be increased. So prostate specific antigen does not diagnose cancer, but it can tell you whether or not you have abnormal thing going on. So after they do that test, if it is normal, there's no need for them to proceed any further. You understand, Brother Brown, especially at your age. But if
Yes, sir. The doctor said it was normal.
okay,
It was normal.
Okay, but every male should, after you reach a certain age, should do that test. Although some places they don't put a lot of emphasis on it. But Black men tend to have a high incidence of prostate cancer. Until now, I don't think they can tell exactly why, but that is part of our burden that we have to carry. I have family members on my mother, on my father's side of relatives that several of them have died from prostate cancer, and some younger ones are having it. The person who spoke at my wedding, Mr. Lee Peter, was giving joke there and so on. He died from prostate cancer a few years ago. But let me say, he was one person who decided that he was not going to do the surgery. So he just palliative care he got. And if the man lived more than 20 odd years with that, can you imagine if he had done the surgery? He would still be alive. He has a brother who did the surgery, older than him, and did it 20 odd years ago and still alive. But to each his own, eh?
Sir,
Yeah.
Ella Fagan, you know, that's what my father died from last year, in the prostate.
Oh,
And
cancer.
yeah, that's what he died from. But you know, it seems like he knew a long time, sir, but he didn't tell the children them anything. So when everything get bad, now when him start to take down, and him take him now to the hospital now, and so now it was gone. Now it was just a gone. Because he didn't tell them anything.
Yeah,
Because
because
they would have taken him to the doctor, you know, they would look after him and everything like that. But he didn't tell them anything, sir. Never tell them. So when him take sick on them, now and them went now and called me and everything, it was a Ghana.
that is bad. And it's the same thing with my cousin. His son, when they go to the same church, he not tell him nothing. And them in the same religion and everything. I never discuss it with them. He never discuss it. So it sometimes people, I don't know if they want to die with their dignity or what, but they not disclose it. But let me say, when you disclose it, you have you get more help. You have people who pray for you more, and so on. Okay, so somebody was reminding that Colin Powell died from myeloma, and that was a cancer of the blood, as we mentioned. So Missionary Brown, but the good thing about it, is that your father, what age was he when he died?
He was 88, sir.
So at 88, they will say, you can die from anything, eh? So he had a full life still. He never cut him short.
No, but probably if they had catch it earlier, sir, and him
He
to
could
tell
have
them
made the
probably he could
century.
live longer.
He could have made the century, yeah?
Yes, he could have lived longer, sir.
Yeah, man, he could have made the century for them
Yeah.
people there who live them something there. It's true you the constitution hold them strong.
Yeah.
And you could have still enjoy talking to him now.
Right. And so over there, sir, I just said a treatment, they call them in for treatment and all those things. And it's not like we out here probably have to pay the whoop of money or anything like that.
Which we can't afford.
Yeah. Even when he was getting healthcare, sir, healthcare come in 4 times a day, come take care of him and everything. The Cancer Society place him come in, was there with him and everything like that with the family and everything by
Yes,
himself. So he could have lived longer if he had told the children them.
yes,
And since my brother realized that now, he make sure I'm going and do his test them.
yes. And let me say, after a while, I mean, your health diagnosis is your private business still. It's not something that you have to go broadcast. But my sister, you know what, my sister never afraid to talk around with her. And because of that, everybody from the community came and prayed with her and prayed for her. And church people all across the island. And I think that is what enabled her to live 1 year after we then find with her. And I am telling you, I see that cancer pull her down to nothing. And I have seen it do that to other people. When you look on them, if you never, within the space of a couple of weeks, if you see what happened to them look like that's a shadow of themselves. Them look like feather, or them look light. And because of that, you know what they do at Hope Institute now? You will go up there and see somebody who is going to die tomorrow and look quite fine because they give them blood and so on and make them look good. For one of the things that the cancer does, it calls anemia. Make you look weak out.
He wouldn't take the blood, sir. He wouldn't take it.
Because he was a weakness?
No, I was a witness, but him decided I'm not taking any blood. And I was even him from down here, I was telling him that I do blood transfusion and something I think for anemic. But him saying don't want it.
So that is what I tell you, say people have choice. And when people say so, it doesn't matter which professor, you can't force them because them say, "I'm not taking it."
Right, and they have their rights. You can't force him. Even if him don't want to take a medication, the nurse him can't force him.
No, man, and that is how it should be. But it is not a totalitarian country you are in. It is a democratic country and people have rights and you can exercise your right. All right, I don't think we can go much further for right. We are hitting the 9:30 button and I don't want it to be said that the first one, and I figure never know if he control himself.
Thank you, Fagon.
Yes, sir.
Thank you.
All right, so it was a pleasure doing it, though.
Right, we really enjoyed tonight. Really enjoyed, and we are educated. And we decided that at different times, at different topics, will be coming on because we are physical and we are also spiritual, right? So, but remember now that we are physical beings, and yes, Bible says, "My people are destroyed because of a lack of knowledge." And sometimes because we do have the knowledge, we are destroyed. Amen.
And sometimes we don't know that when the anointing leave you,
They will come like any other man.
All right. All right. All right.
Yes, as long as nothing can trouble anybody when the anointing is there,
All
but when
right.
the anointing move, it come like any other man.
All right. All right.
God bless you. God bless you. Elder
All the
Fagan. God
best.
bless you, everyone, tonight for your listening, and give that you turn out, and you this will be available on recording, so we can go back over. Amen. And let the cow take up something and chew it again and get it digest properly. All right. God, let us bow our heads at this time. Eternal God and our Father, in the name of Jesus, we thank you, Lord Jesus, tonight for your words of advice to us, Lord, in the physical realm. And you said, Lord, we must know earthly things. Oh, for if we don't know earthly things, it's more difficult to know heavenly things. Thank you, Lord, for the presenter tonight in the Fagan, and thank you for everyone. For we ask in Jesus' name. Lord bless you and keep you. Lord, make his face shine upon you and be gracious unto you. Lord, lift up his countenance upon you. Give you peace. Let all the people say, Amen. God bless you. God bless you.